If you're under lockdown or you've been told to shelter in place because of the COVID-19 coronavirus outbreak, you might very well be concerned about how you can access veterinary care for your pet should they become unwell, or how you can get them the treatment that they need if you know they have a long-term illness that you're managing. Well, today I want to hopefully put your mind at ease to assure you that if your pet does need care, then you will be able to access it. And I want to share some strategies that vets across the world are taking to keep themselves safe, to keep their staff safe, and to keep you as the pet owner safe from potential spread of coronavirus. Hi, I'm Dr. Alex from ourpetshealth.com, where my aim is to help you and your pet live a healthier, happier life. And while you're in lockdown, if you want to read up on the top 5 ways to keep your pet as happy and healthy as possible, check out the link up on the card now. And the first thing to say is that your pet's vet is likely still open. They're still providing a service to look after their patients. Now, that might not be the service that you're used to. It may very well be limited to emergency or urgent treatment only. It might be that you can't get that nail clip that you have done every 3 months for your cat, or that anal gland expression every 6 months for your dog. That might have to wait until things settle down. But if your dog or your cat does become unwell, if you've got any particular concerns, then the chances are you will still be able to see your vet. There are vets and nurses and receptionists and technicians working tirelessly across the world to make sure they look after their patients in need. Now, that might look slightly different, and that protocol of taking your pet to the vet might be very different, which I'll come on to in a little bit. But the first port of call, no matter what concern you've got, what query you have about your pet's health, would be to simply call your veterinarian. It may be that they have to direct you to another service provider, but they should be able to provide you with some telephone advice to help put your mind at ease if that's all it takes, or to let you know what the next step needs to be. The next thing that might happen is that you might need to have a video phone call with your vet. So that might help them triage your pet better. So it may well be very obvious from the phone call that you have with them that they need to see your pet in person, that you need to take your pet into the vet clinic, and they'll give you specific instructions if that's the case. But it may very well be that they think that over a video phone call they are able to assess your pet. You may be able to show them the skin lesion, for example, if they're itching, or the eye if they've got a bit of conjunctivitis. And it might be that with a result of that conversation that you have with that video footage as well, which can be so important, and I'm always talking about the importance of video when it comes to helping your vet and helping your pet, then that might be all that's needed. They then may be able to post out the medication to you, or it may simply be a case of you driving by the clinic and picking up a bottle of medication without actually needing to enter the clinic and without needing to expose yourself to any unnecessary people. So if your dog or cat does need to get taken to the veterinary hospital during a lockdown or a shelter-in-place situation, then it's going to be very different. It's going to look very different. Now, I can tell you what happens at the clinic where I work, but this is very similar to what's happening across the world. I've seen reports of this in the UK and in the States and in Australia and in lots of other countries as well. The first thing to think about is only take one person, so you don't need the whole family to go with you. That exposes them unnecessarily, exposes the veterinary staff to more people than is necessary as well, and that's not great when it comes to controlling the COVID-19 outbreak. You need to advise your veterinarian if you have been in contact with anyone who has showed signs or symptoms of COVID-19 or been diagnosed with that, so that they can be better prepared to protect themselves and to take the best care possible of your pet despite that. Also, telephone them to let them know when you've arrived. So sit in your car, stay in the car park, telephone them to let them know that you've arrived. They will then advise you what the next steps are. It might be that a veterinary technician or a veterinary nurse comes out to the car and actually picks up your pet there. It might be, as is the case in the clinic where I work, is you take them up to the door. We're only allowing one person into the clinic at any one time. You confirm your details, you confirm that you've not had any contact with anyone. You then come into the building, and we're asking people just to pop their cat in a carrier down by that front door, or there's a lead there to clip your dog's collar to that lead. You then take a step out of the building and then go and wait back in your car. What will then happen is the veterinarian and the nurse or the technician will examine your pet. They will find out what's wrong. They maybe speak to you over the phone as well, just to take a better history, to be able to answer a few questions and discuss their findings with you before then formulating a plan to how to give your pet the treatment that they absolutely require. If your pet's been admitted, then obviously that's going to be discussed separately, and they'll be in the hospital for a period of time until they're better. But if after a consultation you can take them home again, then you will get the medication. That process of getting your pet to the car will be kind of replayed in reverse, and it might then be that you're asked to pay over the internet through internet banking. It might be that you can use PayWave, Apple Pay, whatever it is, a wireless contactless method of payment. If you do need to use a PIN pad, obviously you need to punch in your PIN. You want to think about washing your hands really well after you do that, because that will have been touched by other people, although very often in most situations it will be wiped down between each person using that. It could be that you use the corner of your card to actually punch that pin in as a way of not touching things. And remember, one of the main risks of COVID-19, apart from people kind of being in contact and coughing and sneezing on you, is through touching surfaces that someone who is infected has touched, and then you touch your mouth, nose or eyes, and that's how we get the infection. So minimizing the amount of contact that you're having with different surfaces, and also washing your hands really well or using alcohol rub is very important. Now, if you want to learn more about coronavirus, the risk to your pet, and if there's any chance of your pet transmitting it to you, then make sure you check out the video on screen now. Remember to check out my free guide with the 5 steps to keep your pet as happy and healthy as possible. And until next time, I'm Dr. Alex. This is Our Pet's Health. Stay safe out there.